Hello, and thank you so much for joining me today. I'm Jayney Goddard, President of the Complementary Medical Association, and I'm being joined by Jesse. He's the CMA. He's the CMA little dog. If he pops his head up, please don't be alarmed. Anyway, but more importantly, everybody, I'm actually being joined today for our interview, for our showcase interview, by none other than Dr. Kourtney Chichilitti. Kourtney, did I say that right? Is that
You said it perfect.
perfectly? Oh, well, we had a few practice runs. I do apologize. Anyway, Kourtney, I'm so glad I nailed your name. That's a very good start to this discussion. And I have to say, when I saw your booking come through for this session, I was so excited because obviously your background is that I take it your doctorate is in pharmacy. Is that right? Yes.
It is.
Yeah. And so
21
we
days yesterday. I can't even believe it.
really.
Yes.
Bless, that's fantastic. Well, look, I was honestly so excited. We do actually have a few pharmacists working, as members of the Complementary Medical Association, but you guys are few and far between, and we love pharmacists. Because your viewpoint that you bring to everything is so granular. You're so brilliant at the work you do, and pharmacy qualification takes so many years. I mean, you guys are just absolutely extraordinary. So, I mean, seriously, hats off to you. But I bet our listeners and our viewers are thinking, well, hang on a second. How did Kourtney morph from pharmacy to being involved in complementary medicine? Would you be able to tell us a little bit about that and how all of that happened?
Yes, and it's interesting. And I think a lot of us pharmacists kind of have our story to tell that starts with our own health journey. So for me, I've been in pharmacy for 21 years, and most of my career was in like mom and pop, small, independent, like retail pharmacy. So it was kind of like we really got to know our patients really well. So they were like family. And, you know, starting, with every time filling a prescription for somebody, there's a time and a place for traditional medicine, of course. But when I kind of started seeing a pattern over time of I'm dispensing a medication for maybe, I don't know, cholesterol or an antibiotic or something. And then I'm watching people, 6 months later, a year later, onboarding other medications, and them still coming in and saying, what can I take for this? Because not looking at drug nutrient depletion and now we're lacking things or we have things in our body we're not supposed to. And at somewhere along the way, I realized like, am I becoming part of the problem and not the solution? And my own health journey started really my whole life and not really understanding, falling into the Western medicine pattern of anxiety, IBS, I have endometriosis, and all of these things that kind of chased me from when I was a teenager into adulthood. And at 40, they wanted to give me a hysterectomy. And that was when my eyes popped open and I was like, wait a second. And you're saying this still might not really help me. And then I really started looking and I really started to dive into things in the functional space. And when I realized that I had a lot of mold exposure, especially from the building I was working in, how that was becoming neurotoxic. And then the nervous system, how a very traumatic event happened and the mixture of neurotoxins chemically and a traumatic event set forth a reaction in me that made me feel so sick. I wasn't forming my words, my sentences. I thought that there was something very, very deeply wrong. And that made me dive down the rabbit hole of how do I fix this? And none of the Western medicine prescriptions worked. Nothing was fixing it that I learned in pharmacy school. And I had to kind of take it on myself to start to look at these root causes, learning what's going on with my lymphatic drainage, what's going on with my gut health, what's going on with my cellular health. So when I tied it all together and started to, do these alternate therapies on myself and learning about energy and healing all these things in the body, and then started working with my patients and bringing things to them and seeing results, it just led to me now having my own private practice that does almost, I don't want to say the opposite of what I do as a pharmacist, because I very much use all of my education and learning from that standpoint. But, it's always like, let's start with the foundational things first, and then what we need up the way. If a prescription's needed, absolutely, we can go there. They can bridge gaps, but starting from the basics.
Mm. This is beautiful because the thing is, I mean, it's the real essence of holism, isn't it? And it's using the right tool for the job. So none of us in complementary and integrative medicine are chucking the baby out with the bathwater, to use that very old phrase. But making sure that we are providing the very, very best options for our patients, our clients. This is so fantastic. So what are the predominant modalities that you use, Kourtney, in your practice?
So I really take an approach of my root cause approach is really 5 pillars. And I feel like these 5 pillars are basically that everybody needs, whether they have symptoms or they don't. Everybody needs to support their nervous system. Everybody needs to support their cells. Everybody's liver's the most overworked and underpaid organ in the body. So people say, well, we're exposed to all these chemicals and toxins and pesticides, preservatives. We should be able to process them, but our bodies are becoming overloaded with them. So yes, we have a liver that should do that job, but if we're not supporting our liver the way that it needs to be, then it's not going to be able to process things and things are going to build up, which brings us to the lymphatic system. If we're not helping aid that along, right, our circulatory system, we have a heart and that beats our blood through our body, but our lymphatic system can stay very stagnant if we're not intentionally moving our lymph and, using things like vibration plates or rebounding, supporting minerals, good sleep, all of these things that when things stay stuck in the body, this is where disease happens. These are where the symptoms start, almost as like a poke, like a red light, check engine light in the car coming on, like, hey, this something's going on, something's imbalanced. Let's get this in check before the disease happens. And then of course the gut. I think the gut-brain axis is so overlooked. And I always say to people, for lack of better words, the vagus nerve is like a ball of yarn in the brain and it travels down to the hiney and it drops off at every organ in between. So any emotional, physical thing going on in the body affects our organs. It's stored in our tissue, whether it's current stress or past traumas that we're not addressing. These things affect our health, and I think a lot of people don't understand that. And I learned it the hard way. So now I'm trying to teach not only my patients, but now practitioners through my course that's been accredited by the CMA to say, hey guys, we didn't learn this stuff in school. Like, we need to make sure we're addressing these foundational factors. And until we do, we're just going to be slapping these prescription band-aids on people and they're going to stay stuck in their health and it's going to lead to further disease.
Yes, yes. This is so vital, and I absolutely could not agree more. Are there any particular modalities within the sort of the complementary integrative medicine framework that you specifically use, particularly when you're teaching? That's, I think, something that's very interesting for viewers and listeners.
So I always say, and I know it sounds funny, but I always say nervous system first. And I know that's not looked at. I mean, we don't even talk about the nervous system in traditional medicine, but I always say to address the nervous system, stress level, stress management, looking at, that causes just as much inflammation as eating a poor diet. So I stress to practitioners, this is something we very much want to work on with our patients to say, okay, we're going to start with these basic foundational things. And this looks different for every person. Everybody's background, my practice is very personalized and I teach my students the same thing. Everybody you look at is a bio individual and they're going to have their own backgrounds, their own health issues, their own genetics. All of these things come into play. So all of that needs to be looked at and addressed before you can address anything with anybody. We need to look at these, key factors for each individual person. And I stress different, whether it's breath work, whether it's different somatic exercises. I think even just taking a second to get grounded and looking at the surroundings in your room to say, hey, you're safe. Our bodies don't know the difference in 2026 between being chased by a bear and just living in this, everything's Amazon, DoorDash. You touch something and it's here in less than 24 hours and it's like bing, bam, boom. And our body, our dopamine, we're in this like cycle of like, okay, let's go. We don't know how to just take a rest and say, I'm just going to give myself some peace, 5 minutes of meditation, some breath work to just kind of say, okay, we're in this room. It's safe. There's nothing that our body needs to feel like it's reacting to. And I feel like first and foremost, that's what we need to address because none of the other things that we do can work without that. And then the next thing is detox. Like I said earlier with the liver, I think so many things are misunderstood when we look at things like, heavy things like perimenopause and autoimmune disease. And I just think there's such not Western medicine diseases. I think these are foundational things that when we look at the terrain of the gut and we look at the liver and giving it the support it needs, most of these symptoms can be controlled by just giving your body the support it needs by taking in essential fatty acids, essential amino acids, meaning essential. Our body doesn't make them. And if we're not supporting ourselves in that way, we can chase all these influencers with all these products. You're going to look this way, feel this way, take this, take that. But if you're not supporting the foundational things and really giving the gut and liver what it needs, we can't process our hormones properly. We can't detox properly. So, that's the first thing I take people through. And I say, it's kind of like I teach my practitioners, we need to go low and slow with detox because you don't want to make people feel like crap. There's a wrong way and there's a right way to do it.
Yeah.
So I teach my practitioners, first we got to open lymphatic drainage. We got to get that going before you can take out the trash, right? So it's a very low and slow process that I take my patients through that I'm now teaching my practitioners, my students, hey, this is what we do to get the results for people so that they can feel their best and have energetic, vitality.
Yes. This is so fantastic. And I guess the first question is if anybody is inspired by this conversation to come and see you, to seek help from you, if they're, let's say, potentially a client, a patient, how would they find you? What is the best way?
I would say mostly through my website. They can find pretty much everything on there. They can book an appointment. If they're ready to dive in, they can dive into one of my programs. But first and foremost, as a patient, they can even just set up a call with me to just go over and see what's what. Because, like I said, everybody doesn't need the same level of care. Everybody has their own issues, and I like to create bio-individualized programs for each and every one of my patients that works for them because we all have different stuff going on. So I always direct people to my website to kind of check out what I do and my different services, even labs, functional labs. There's a time and a place for them as well, right? Sometimes they can get very expensive. So I try to say, when I see something that I think is taking a worth looking at a little deeper, great. Let's keep things affordable and dive into what is necessary. Even when it comes down to practice with my students, know when to hold them and fold them. Hey, this is a great lab to use, that can tell us a whole lot, that creates a roadmap that we can say, all right, this is what we need to look for. So on my website, and practitioners can find me there as well and check out my CMA course that is, that breaks down all of the modules they can do self-paced. And then I give them that monthly support 3 times where they can ask questions and give them what I didn't have. I had to kind of go through it and learn the hard way. And I want to clinically support them so that they can help their patients.
Fantastic. Honestly, this is so great. So tell me, first of all, the practice website is what, Kourtney?
It is www.wellness-solutions.co. And that will take you into, I actually just converted it. I'm working with a wonderful marketing company and we converted it into an app. So it's more seamless now where it's more organized so that people don't have to kind of search for things. So it's kind of like, I'm a patient, I'm a practitioner, and it kind of takes you through each, section and can give you the information that you need. And then of course to book a call through there.
That is fantastic. It really, really is. And so with your teaching, how long are your courses?
So the course that I have, the Root Cause Reset Practitioner Certification through the CMA, is 1 year long, and basically it is 10 pre-recorded modules. And in there, I break down all of the things, all of my pillars. So we talk nervous system, cellular health, we talk about the gut, the liver, we talk about detox, cleansing, all of the things, self-navigated. So I know people are very busy. Practitioners obviously are have a hectic life. So it's self-paced. Twice a month, we come on for question and answer sessions for clinical support. They can bring all of their questions, whether it's from modules or something they might be stuck on with one of their patients. And then once a month, we work on lab reviews. So whether it's dry blood spot testing or an HTMA, hair tissue mineral, or looking at a deeper dive on a gut a gut testing
Mm.
lab where we send in a stool sample, and really teaching practitioners not just, oh, here, run these labs, but what to use and when to use them.
Yes.
So really kind of teaching them what to do there and then how to interpret, because they are very intense. Functional labs are not your average labs that you get from your regular doctor.
Yes. Yes.
They're interpreted very differently
Yeah.
to actually help people see what's going on and get the results.
I know they're absolutely fantastic. It's so exciting to me that you're doing this. You're bringing a very different viewpoint, because of this extraordinary background in pharmacy, and because of the way that, you've observed your own patients coming into the pharmacy and looking after those people and getting to know them as people. This is something that conventional doctors with their 5 minutes that they're allocated, 10 minutes at best, if you're very, very lucky, they do not stand a chance of getting to know the patient. So you've actually come at this from a very different perspective and realized that, this is not 100%, the answers aren't really being, the needs aren't really being met, the answers aren't there necessarily. So I love the way that you see, the thing is, what you're doing with your background, it's so rigorous. And I think that's why what you're doing is so incredibly exciting. And, within the Complementary Medical Association, we do strive for rigor within all of our members, whether it's people who are practicing or teaching or are approved suppliers and so on. With the approved suppliers, show us your data sheets, practitioners, show us your qualifications, schools. Okay, great. Show us the syllabus and what are your qualifications and so on. So these are the sorts of things that we look for. And this is what's absolutely music to our ears. When we've got somebody with your level of expertise who speaks so beautifully and eloquently about the human condition and the fact that, we're not all bioidentical. We are individuals with our own set of genetics and obviously other factors within our lives. Obviously in homeopathic medicine, we call these maintaining factors or exciting factors, what's caused the problem, what's keeping the problem going. And so, it's beautiful the way, your viewpoint is so exciting and unique. And I think that's something that really it makes you really stand out as a practitioner and as a trainer. So I think it's just so exciting. And actually, Kourtney, we've only got such a short space of time for the showcase, but we do have to get you back because there's much we need to go much deeper into your work because it's just it's so exciting. I feel so lucky to have been able to have this time with you.
I feel the same. Thank you so much for having me on. This has been just wonderful. And I thank you so much for your kind words. It really has been a blessing to become involved in the Complementary Medical Association. I wish that I would have found it sooner. And it was through a UK practitioner, one of my friends that lives in the UK. And she actually introduced me to you guys. I didn't even know. And it's been just a blessing, just such great information, just connecting with great people. And I'm
Oh.
blessed to have met you and to be on this call.
Thank you. Well, no, honestly, likewise. We're so pleased that you've joined. Take care, and we'll definitely see you soon, Kourtney. Honestly, so thank you.
Thanks, Jayney.